Good afternoon, esteemed members of City Council and distinguished members of the Budget Committee. I am Jim Hertz. I'm representing the Human Resources Department, and it is my privilege to present to you today our proposed budget for fiscal year 2025. Through this presentation, we aim to provide insight into our strategic allocations of resource, mindful of the crucial role our department plays in supporting city employees. The City of Springfield's department provides comprehensive services to every department of our workforce. This includes the areas of payroll, employee and labor relations, which includes classification and compensation, labor and contract negotiations, administration of volunteers, risk management, which is all of our insurance programs, our benefit plan, which is a self-funded benefit plan with an on-site clinic, which also includes the support of leave administration, workplace injury, modified duty, talent acquisition and onboarding, and of course, citywide training. With expertise spanning in areas like payroll administration, recruitment, training, risk management, benefits administration, and employee relations, each member brings a wealth of experience and passion to their respective roles. Fiscal year 24's accomplishments included, and certainly are not limited to, the implementation of Oregon's paid leave law, software integration and implementation for performance evaluations, training management software, and a policy administration database. Additionally, the HR took the next step in promoting employee wellnesses by transitioning the previous Know Your Numbers, which was a biometric screening, to a comprehensive annual physical exam program, which included the annual physicals or specific physicals for our fire suppression workers. Additionally, the HR department continued its efforts to expand the diversity of its workplace, which included an increase in the third straight year, moving it up to 12.55%. The proposed FY25 budget for the Human Resources Department is staying relatively flat, with a few exceptions, one being inflation costs for our insurance liabilities, and then one-time expenditures through the EAP reserve funds to support employee wellness. On a positive note, we are really excited to announce that the general liability claims over the last year was a 5-year low. It's something that we've been working very hard to get on top of and lower our exposure as a city. So within our budget summary, I wanted to identify specifically the additional funding that we were requesting under 7062 workers' compensation. I wanted to ensure the committee that most of this is really related to a one-time spend, pulling reserve dollars from our EAP plan, which is our employee at injury program. And this is funded through revenue that we receive from the state related to when we're able to get an employee back to work early. Through modified duty. So with those dollars, we're spending out or pulling out $410,000 or roughly $410,000 to use as an opportunity to build an employee wellness area for on-site health, as well as a $6,000 fund that we're pulling out for actuarial reviews. The remaining part, which is $89,000, are directly associated to rate increases to premiums, and then $135,000 are dollars that we expect to use for claims expenses. Looking ahead to the next fiscal year, there are 3 core areas that the Human Resources Department will focus on. One of those is the employee benefit cost. That is a primary driver for the HR department. It's a long-term strategic initiative that we have, and what we're planning to focus on over the next year will be 2 things, which is one is, as I mentioned in the previous slide, using the employee at injury program reserve funds to build an on-site fitness equipment within City Hall. The second part of that is we are working with our partners, the school district or the Springfield School District, to pilot the on-site physical therapy services within the city's employee wellness center. This would be an enhancement to our on-site free clinic and a way to divert money that we would otherwise spend on insurances. And so the concept is if we can bring it in-house, we should realize long-term cost savings within our own plan as well as long-term productivity improvements. Additionally, we will continue to focus on employee citywide training with the implementation of new software that allows us to provide those services. We're now looking at ways to enhance that through certifications and credential training, as well as annual required trainings. And then lastly, recruiting and turnover. I've got more slides on that subject, but those continue to be an area of challenge with us as we're trying to right size ourselves with the recent inflation that we're just now trying to catch ourselves up to. As I just mentioned in the previous slide, turnover continues to be an area of thought and oversight within the HR department. We're pleased to see us returning back to more of the traditional normal turnover, which is hovering around 8 to 10%. But as you can see, the increased turnover that we experienced through the 2020, 2021, and 2022 years has put a strain on the human resources as well as within our various operational departments. With high turnover comes increase in recruiting efforts, and this slide kind of shows the peak that we experienced in FY23 in our hiring. We are on pace to be something similar to that as we're just passing the midway point of our fiscal year. We've already had 48 hires this year, 48 postings with 37 hires, but our ability to keep pace with our turnover, as demonstrated in this slide, has been a challenge over the last few years. With turnover comes opportunity in hiring to expand the city's diversity. This slide shows the FY23 workforce as it relates to minorities within our own population. And we continue to make progress in this area, getting more closely reflective to the community that we serve. When looking at the diversity of your workforce, it's important to recognize the different EEO categories and understand where you sit based on the availability of applicants within your community. This slide outlines the EEO, the federal level categories that they look at when looking at the diversity of a workforce. The blue indicates areas where our population reflects that of the available applicants or minorities percent of actuals. The red area indicates the areas that we are below the 80% rule, and then the green area is the percentage gap that we would need to get to completely mirror the applicant availability. Within this slide, you'll see that significant work still needs to happen in the areas of officials and administrations, which are your professional leadership positions, and then of course your professional positions as well. It's the other area where we see the biggest need within our workforce strategies and recruitment efforts. So now I'm going to transition to really specifically looking at three of the HR department's core reserve funds that we oversee and have fiduciary responsibility for. Let me start by talking about the city's self-funded medical reserves. What I want to highlight specifically in this chart is one is the growing asset of reserve dollars. And then more importantly is the expenditure line. So what this chart shows is that from FY15 to current, and actually you could date this back another almost 10 years, you will see that our expenditures have been relatively flat, which is something that's been almost unheard of from any other plan that I've ever been associated with. And as a result of this, we've been able to hold the fees, which has the impact to the department in the general fund, flat for about 11 years. And this success has primarily occurred through the smart utilization from our employees, but more importantly, their access to an on-site clinic that diverts money that would otherwise get charged to rate increases through our insurance to a direct bill to the city. Now talking about the city's property and liability insurance reserves. On the positive note, our claims experience is at a 5-year low, which has resulted in a reduction in our annual deductible or common deductible for police, which is now reduced down to $250,000, while other GLs remain, our general claims remain at $100,000. And even though we do continue to see a significant drop in our claims, we do have a number of claims that are still in the litigation process. And then lastly, the more negative side is that globally we continue to see an increase in property insurance premiums, and those are expected to increase by another 17.5% over the next year, primarily a result of all of the large-scale natural disasters and trends that have continued to happen in our country. And lastly, talking about our workers' compensation reserve. Now, the city made a change back in 2021, moving from the CIS program to the Safe Corporate Safe Corporation as our insurance provider. This has resulted in significantly fewer expenditures. So we are still working towards decreasing the reserves as we move to a more premium-based service through SAFE. Premiums are expected to increase by less than 5% because the city continues to have very favorable workplace injuries as compared to our comparators. So as we look ahead, the strategic initiatives for the Human Resources Department through 2028 will remain the same as it was in previous years, focusing in 5 core areas. One of those is benefit cost controls, turnover and recruitment, property and liability insurance costs, the technology that we need to support our employees, and lastly, citywide employee development and training. With that, that concludes the Human Resources Fiscal Year 2025 budget presentation. I appreciate your time and thoughts and considerations to our requests.